Hi, good afternoon. We're going to do a cheek injection, mid-face injection. We have a young, beautiful model who's getting ready for a pageant. We want to make sure she's rested. She's got nice high cheekbones. One of the things that people, the misconception about cheek injections is people automatically think that it's going to make him look heavier or more obese, and that's the absolute opposite. It actually contours the cheeks by creating more lift. However, there's different zones to the cheeks, and you'll see where we're going to go with this patient. So we're going to use Juvederm Voluma. It takes multiple syringes, but we're going to start slow and go little by little. The needle's extremely small. We're going to start in this zone right there. Close your eyes, happy thoughts. She's naturally a smiler. Trying to get her not to smile so we can see the cheeks where they're rested. The injections are down, they're on top of the bone. And I'm creating little tunnels. People go, well, how do your patients take it? How is it pain-free? It's not pain-free. They're feeling it, but they're tolerating it. Nobody's crying, even if you see a little tear. It's very tolerable. Never had anybody not be able to finish the injection. Sometimes we'll give you a little break, but it's very tolerable. And you can see it's little by little, deep injections. And immediately, if you just look at the contour that's created there versus the other side, if the camera just goes from the 3/4 view on this side versus the 3/4 on the, you can see the flatness here, where now you can see the contour on this side. And that's not even the full syringe yet. So you can imagine what, 2 syringes, 3 syringes, 4 syringes would do. So a really nice result. Kind of pulls up the cheeks little by little by little. We're doing good. Close your eyes, happy thoughts. Hang in there. The closer you get to the midline, closer to the nose, closer to the lips, hurts a little more. But she's being a champ. 1 to 10, 10 being, oh my God, how bad is this pain?
Say about 4.
4. That's
maybe 3.
Maybe 3. And you can see what one side does. What we're going to do is, my assistant's going to hand her the mirror. I want her to see what one syringe on one side did. It's called the split face study, and she'll be able to see. So it's a 1 syringe of Voluma. It's 1 cc. 1 cc is 1/5 of a teaspoon. That's how little it is, but it makes a big difference. So go ahead and hand her the mirror. You can grab the mirror in your hand. You ready to see it?
Yep.
Okay, compare the 2 sides.
Wow.
See the change? Just a little bit, it contours it up.
Wow.
That's just 1 syringe. 2 syringes gets more. 3 syringes gets up a little bit more, and then you can create more and more definition, more contouring here without any makeup. And if you look at the 2 sides of your face, if the camera comes right down the middle and compares the 2 sides, you can kind of see which side's more lifted. Just look at the right side, looks more lifted. This side is healthier, younger looking. This side looks a little bit droopier. And this is the prettier side. Typically the left side is the prettier side, but now the right side is more lifted. So we're going to keep going and do the other side, and then we'll do some before after pictures. Okay, so let me come around. I'm going to do the other side. Now, the 2 sides feel different. The pain is different. Sometimes people are more sensitive on one side, not the other. Sometimes people bleed more on one side versus the other. But you can see she's doing very well. So I think 3 syringes will be the sweet spot for her. 2 gives a really nice result, but some of this is going to settle down in the next week or 2. Her pageant's coming up in 3 weeks, so we want her to look amazing 3 weeks from now. I don't want her wishing, hey, I wish I had a little bit more fullness. I'm going to show her before telling her to do a 3rd one. I always give them the option. Do you want to do a 3rd one? Do you want to do a little bit more? Or do you want to wait and come back in a few months for that?
Yeah.
So I'm going to show you here in a second.
I really can't feel anything.
Yeah, see now it's better. This side's actually more comfortable. I'm gonna come around, take a look. Compare side to side. Now you can see the left side is always the prettier side, so it takes less to achieve a nicer look on the left side. On most people, on 90% of people, left side is their prettier side. So usually I put a little bit more on the right. Some people have a prettier right side. The vast majority of people have a prettier, more lifted left side. And I can create a little bit more symmetry by lifting the right side a little bit more. So that's 2 cc's of Voluma. Again, 2 is still less than half a teaspoon. A teaspoon is 5 syringes. So when people think, oh my God, he's telling me I need 3 syringes, that's barely half a teaspoon. And you can imagine this space can definitely tolerate 1 teaspoon or more. All right, let's do the same thing. Show her the mirror. Have her take a look. Take a look.
Wow.
See that?
Wow.
See how much less and more rested you look? Look like you went to Acapulco, had some good food, slept well, right?
Wow, it really, there is a contour already,
yeah,
I can see
yeah.
it.
Do you want to do a little bit more? You're happy here? We can stop here if you like. I think it is a nice improvement, and then do the next step later on.
Yeah, I like this.
Okay. Let's stop here.
I feel the contour definitely.
Plus, we don't have any bruises. Let's stop here because the next one maybe you don't want the bruises you. So this is a good place to stop.
That's a good one.
Yeah. Cool. Awesome. And that's it. So that was cheek contouring using Juvederm Voluma. That's my favorite go-to substance. I don't like Radius for the cheeks, but Voluma is fantastic for cheeks. So occasionally I'll use something like Velour with somebody with really thin skin. But Voluma is fantastic. And again, there's room for more, but this is a nice starting point.